Tomorrow marks the first day of North Carolina expanding Medicaid coverage. Good evening, everyone. Thank you so much for joining us tonight. I'm Angie Quesada. The new expansion will bring coverage to more than 500,000 people who will now be eligible. Now on your sides, Davis Suppes spoke to some healthcare officials across the state. He's joining us now in the studio. So, Davis, who is this expansion going to benefit?
That's right, Angie. This expansion is going to impact thousands of working North Carolinians. It's also bringing in billions of dollars each year to the state with no additional cost to the taxpayers. And State Health Secretary Cody Kinsley is excited about this happening.
80% of the folks that are going to benefit from this are in working families. So think about mom or dad who are working multiple jobs, who are taking care of their kids, who are also taking care of their parents and are trying to manage all the complexities of their lives. Frankly, the folks who have complex lives like that are the ones that stand to benefit the most from this tool.
Costs for healthcare are not cheap, especially when paying for things out of pocket.
Sometimes you walk out of the provider's office with a prescription in your hand. So many parents that are uninsured and individuals that are uninsured go to the pharmacy, find out that the prescription's too expensive. So then they call the doctor and try to get a generic, or they try to find a program or a coupon to try to help cover that. Now they have health insurance and it's going to be covered. If they do get really, really sick, they don't need to sit there and wrestle over, am I so sick that I should go to the hospital or the doctor? They can just go.
$4.8 billion a year for insurance development. $2.6 billion for 102 hospitals direct billing, and a $1.6 billion signing bonus for other essentials.
The General Assembly has appropriated that many for investments in behavioral health, almost about half of it for behavioral health, and the other half into major workforce investments like allied health programs and training programs at community colleges. It was a great investment opportunity.
The expansion means a lot of applications.
And we expect to see full waiting rooms and some lines. But again, right out of the gate, we've already been able to get half of the eligible folks on. Here's the important thing to remember. If you apply any time in the month of December, even if you're not approved until January or February, your benefit, your coverage will be backdated to December 1st. It's always backdated to the first of the month in which you apply.
Now, here's a quick look at who's eligible with this expanded coverage. Reminder, you have to be 19 or between 19 and 64 and a U.S. citizen living in North Carolina. Single adults who make just over $20,000 a year or less, families of two who make a little more than $27,000 a year or less, and the coverage continues with families of 3, 4, 5, and 6 with total income matching to those families accordingly. To find out if you're eligible and for a full breakdown of the expansion, visit medicaid.nc.gov. In studio, Davis Suppes, 9 on your side.
All right, Davis, thank you.